Canker sores may cause discomfort and itchiness. They should heal on their own, but there are ways to speed up the healing process and lessen discomfort. Over-the-counter gels, mouth rinses, and supplements are a few examples of home remedies that can help reduce discomfort and speed up the healing process of canker sores. A canker sore is a little oral ulcer. It could have red edges and be either white or gray. The tongue, insides of the cheeks, and the space immediately inside the lips are the soft areas of the mouth where canker sores typically appear. They could show up in a bunch or alone. Canker sores are not contagious and often go away on their own in 7 to 10 days. This video will go over 10 tried and true methods for treating canker sores. There are two types of canker sores. First is simple canker sores. These may appear 3 or 4 times a year and last up to a week. And the second is complex canker sores. These are less common and occur more often in people who have previously had them. Canker sores aren't herpes or any other type of sexually transmitted infection, STI. They're not contagious at all, so you can't spread them through kissing or sexual contact. One may ask, are canker sores and cold sores the same thing? No, these sores are not the same, although they are frequently confused with one another. Herpes simplex virus type 1, HSV1, or type 2, HSV2, is the cause of cold sores, often known as fever blisters. Due to their viral origin, cold sores are extremely contagious and can spread through intimate contact like kissing or oral sex. Blisters that are packed with fluid, and cold sores can develop in groups in your mouth or genitalia. On the other hand, canker sores are not contagious and are not brought on by an infection. Let's talk about 10 canker sore remedies. As previously said, canker sores may heal on their own, but there are methods to reduce discomfort, hasten the healing process, and prevent infection. A person with these excruciating ulcers may find that their quality of life is improved by using these solutions. Canker sores may not always respond to the same treatment though, and they frequently come back. Some very useful options are: number 1, using an over-the-counter OTC gel or patch. Over-the-counter OTC medication, typically in the form of a gel or paste, can be immediately applied to the canker sore. This keeps the ulcer from becoming inflamed by contact with hot or acidic meals. The canker sore may also be covered with specialty bandages or patches. These adhere to the inside of the mouth to shield the ulcer from discomfort. Number 2, use of mouthwash. Rinsing the mouth with over-the-counter mouthwash can assist someone in maintaining cleanliness and relieve pain or discomfort. A mouthwash with antibacterial qualities is what one ought to use. This may lessen discomfort from uncomfortable oral sensations and help avoid infection. Number 3, make use of a salt rinse. You can use a saltwater rinse to help with healing. This will speed up the healing process by drying out the canker sores. Rinsing the mouth with a salt solution should not be used as a substitute for medicated mouthwash if the symptoms are bothersome, especially ones that contain alcohol, since this could aggravate the sore. However, it might help keep your mouth clean and stop the spread of germs. Number 4, use a soft brush to maintain good oral hygiene. The healing process can be accelerated by taking good care of the mouth and taking care not to injure the canker sores. It is possible to avoid painful canker sores by using a soft toothbrush. Ulcers can avoid becoming infected by practicing proper dental hygiene, which includes cleaning the teeth and gums. Number 5, taking pills containing vitamin B12. Vitamin B12 is a necessary vitamin that helps the neurological system and brain operate. Additionally, it is essential for the production of red blood cells. A 2015 small study indicated that supplementing with vitamin B12 greatly decreased the pain associated with canker sores. Number 6, sipping tea made with chamomile and honey is advised. In the past, chamomile and honey were utilized for several medicinal purposes. Their usage in assisting patients in reducing pain and inflammation from canker sores is supported by some anecdotal evidence. They should not be used in place of medication, as there is currently insufficient scientific data supporting their efficacy in treating ulcers. There may be anti-inflammatory effects from chamomile. By making a strong chamomile tea and letting it cool, one might use it as a cure for canker sores. In addition, they can put a chamomile tea bag directly to the ulcer by soaking it in warm water. Honey has antibacterial qualities as well. One may choose to steep honey in chamomile tea or apply it directly to a canker sore. Number 7. Staying away from particular meals. Eating meals that are extremely spicy, salty, or acidic should be avoided by someone who has canker sores. These could aggravate the ulcers and hinder their recovery. Toast and other hot beverages, as well as foods with sharp edges, could be uncomfortable. Number 8. The use of aloe vera. Direct application of aloe vera gel to the canker sore may help relieve discomfort and lessen swelling and inflammation. The National Center for Complementary and Integrative Health believes that aloe vera is a safe alternative for canker sores due to its anti-inflammatory properties. Number 9. Alum powder. Potassium aluminum sulfate is used to make alum powder. Pickling and food preservation are two common uses for it. Older research from 2016 suggests that alum's astringent qualities may help shrink tissues and dry out canker sores. How to use. You can combine alum powder and a drop of water to make a paste. Apply the paste to a canker sore and let it sit for at least a minute. Rinse your mouth well afterward and repeat the process every day until the sore disappears. Number 10. Making the mouth numb. To ease some of the pain and discomfort, people might apply or suck on ice chips directly on a canker sore. The cold will numb the area. But before placing an ice cube directly on an ulcer, always partially melt its surface. Canker sores can affect everyone. However, teens and adults in their 20s are the most likely to have them. Experts speculate that hormonal fluctuations may be to blame for this. Especially if they happen regularly, canker sores can be excruciating and bothersome. One way to determine whether there is an underlying cause they can prevent is by keeping track of when they happen and any potential triggers. To reduce pain, one can treat the ulcers and canker sores as soon as they arise by having an over-the-counter medication and a few natural cures on hand. Canker sores are typically not indicative of a serious medical issue and heal on their own in most cases. Nonetheless, they should contact a doctor if one of the following happens. The sores last for more than 3 weeks. They make swallowing difficult. The sufferer becomes ill. Or the sores appear regularly over an extended length of time. In certain instances, canker sores may indicate an underlying medical issue, such as digestive disorders. Anybody experiencing any of the following symptoms should consult a physician. Fever, eye irritation, stomach ache, rash or soreness on another part of the body, or inexplicable fatigue lasting longer than a few days. An infection may be indicated if canker sores become extremely painful and red. When someone wears a denture that is too tight or bites themselves unintentionally, they run the risk of developing single mouth ulcers. They could occur at regular intervals without a clear cause. Some individuals experience canker sores regularly, while others never get them. Some come from stress, food allergy, lack of certain vitamins or minerals, for example, iron, folate, vitamin B12, and long-term illnesses, for example, reactive arthritis, Crohn's disease, systemic lupus erythematosus, and Behçet syndrome. Others from compromised immune systems are risk factors for recurrent canker sores. I trust you enjoyed the video and are enlightened too. Kindly hit the bell to subscribe and stay up to date for more exciting videos such as this. Also, feel free to share your thoughts with us in the comment section below. Thanks for watching.